Hello, welcome back. This is Auntie Kathy with another video. So today it's going to be a two-part video. This is part one. I will be going over IV skills. Number one is continuous IV. So we're going to talk about how to start a primary line for a continuous IV. And then also we're going to talk about how to start an IV line for a secondary or piggyback IV. So the first part is going to be primary. So the equipment that you need, the things that you need is your medication for your IV, for your primary. You need your secondary or piggyback medication. You're going to need your IV tubing for your continuous flow, your primary. And then you'll need your IV tubing for your secondary flow. And then you'll need some alcohol wipes. You need labels for your tubing. And then if you're adding any medication to something, you need a medication label as well too. And a pair of gloves. Okay. So like I said, we're going to start with the primary. So since we're starting with the primary, I'm going to just set aside my secondary medication and my secondary IV tubing. Now the secondary medication set says secondary medication set. And every facility uses their own tubing. So you follow the protocol that you have for your facility. So I'm just going to set that aside. And I'm going to first get my medication for my primary IV. And typically, patients are on a continuous IV solution for many of reasons. One of the main reasons is dehydration or just to keep the patient hydrated if they're NPO. So you have to check the doctor's order. So you want to check against the physician order and the MAR, right? That's your first check. And then you take the medication and you check that against what?
MAR.
The MAR. Very good. So physician's order and your MAR. Medication, MAR.
Yeah.
And then our last and final check, we take the medication, the MAR, and where do we check that at?
Bedside.
At the bedside with the patient. Very, very good. So medication and MAR. Check number one. Medication with the MAR. Check number two. We take the medication, the MAR, at the bedside with the patient, okay? So we've done our two checks, because remember, we're in the med room. We're not at the patient's bedside. I suggest that if you're, giving IV fluids, go ahead and get that all primed and taken care of and set up with your pump, and then take that into your patient's room, okay? So first thing I'm going to do is, before I open up my IV solution, I'm just going to look at the packaging. Make sure that there's no rips or anything like that. It's not discolored, okay? Then I'm going to go ahead and open it up, like so. Then I'm going to put that in the garbage. Bring it over. Or you can just bring the garbage over. Or the bag. Oh, no, never mind. All right, so then once I get my IV solution out of my bag, I want to make sure I check the expiration date. Very important. I already checked the medication, so I know I have the right one. This is 0.9 saline. I want to make sure that it's not moist or leaking, okay? I want to make sure there's no cuts or anything. It's not discolored. It's still clear. Now, if it's supposed to have a color to it, like TPNs, they're kind of have like a little yellow looking color, then that's normal, but this is supposed to be clear. So that's fine. Then if you see here, you have two little ports here. So you have one here, that is where you can inject. So say the doctor says, I want you to add insulin to this. You can inject that with the needle in there. This one right here is, if I take this off, this is where we're going to spike it. And when we spike it, that will allow the medication to come out into the tubing. So if I just do like this, nothing's going to come out because it hasn't been spiked yet. Okay? Now we're going to take our tubing. And our tubing for a continuous flow set says continuous flow, right? And it tells you the drip rate. So your facility will provide the tubing that they want you to use. If the doctor wants something specific, he will state that in the order, and you go get the specific drip set that he wants, okay? In the next video, in another video, I will show you how to calculate the drip set and all that great stuff. So now I want to check the expiration date again. And then I want to check the integrity of the package like we did with the other one. Make sure it's, you know, not changing colors. There's no open areas. It's not moist or anything. Then we're going to go ahead and open it up. Remember, we don't want to be a nasty nurse, so we throw our stuff away. First thing we want to do when we open this up, okay? Trust me. And if you don't do this, I'm going to show you what's going to happen. Don't be like I didn't tell you. I told you. So you want to get a hold of this right here. But what I like to do is I like to take my clamp all the way down and then close it. Right? Close my clamp over here too. All right. So next thing I'm going to do is I'm just going to inspect it. Make sure that that is not any cuts or any rips or anything. This right here is what we're going to spike this to get our fluid out. We want to make sure that that is intact. You don't want to touch that because it's sterile. If you touch it, then you have to get a whole new tubing. We're just going to put it in there. That's our chamber, our little drip chamber. And I just like to look at my IV tubing just to make sure that everything is intact. Put my glasses off. I'm getting old. I told you guys that. Make sure that's nice and there's no rips, because you'll be surprised sometimes. And then here, once we get here, this is the part that goes into the patient's IV. So this is sterile as well, okay? So this is sterile as well. So we want to make sure we don't touch that, okay? All right, so it looks good. So the next thing we're gonna do is we're going to spike our IV solution, and we're gonna put that little spike right in here. Okay, so I'm just gonna teach you guys this way. Don't shake this up, because the more you shake it, you see the bubbles, and you can't have any bubbles in your IV tubing. Okay, so we're gonna take that off. Then what we're gonna do is we're gonna put this in here like this, and we're gonna turn and twist and just push it in. Like so, like that. See? Magic. Then we're gonna put it up on our pole. And then we're going to squeeze the drip chamber, and there's a little indentation right there. You see that? Mm-hmm. We want to squeeze the fluid to there. And the reason why is once we get fluid in there, it helps to decrease the air bubbles that we will get in our primary tubing. So first thing we're going to do here is this. We're going to undo this one here, open it up, and then we're going to slowly open the roller clamp. Now, if you do it slowly, you can get this with no bubbles in it. If you go too fast and you're not seasoned and you don't, you haven't been doing this for years and years and years, you're going to have a mess of bubbles in here, okay? So what I like to do is loosen this up. Don't take it off, because if you hit it against anything, it's going to be contaminated. So I'm going to, see how I just did that? I saved it. Okay. So you see the fluid there? Can you guys see that? Mm-hmm. Yep. See that? See, I would say that's too fast for you guys just starting off as a student. You know, see how that? Mm-hmm. I would slow it all the way down. See how slow I'm going? Mm-hmm. So far, I don't have any bubbles. And then when you get to a port like this, you want to invert it, like so, like that. That helps with the bubbles. So I'm speeding it up, but you can go as slow as you want. Take your time, because it is a beast trying to get these bubbles out. You see where I'm at? Mm-hmm. You see that? And I don't have not one bubble in my tubing yet. See, I'm speeding it up because I'm your auntie. I know what I'm doing here. Speed it up. I'm going to stop it a little bit. Since this didn't touch anything, I'm going to go ahead and put that like that. So it just makes me a little bit nervous. Guys, see it? Uh-huh. Come on down. And then once we get down here, we're going to stop. All right. Now I'm going to close this right here because I want to move this roller clamp and make sure there's no bubbles. And look at that. Look at Jehovah. He gave me a couple of bubbles for you guys. You see that? So now how do I get rid of those bubbles? You go ahead and tap it. Voila. They disappear. Okay? So now our IV is ready and we didn't lose nothing but like a drop of fluid. We're ready to go. Okay? So that is how you prime with no bubbles a primary IV solution set. Please like, comment, and subscribe to this channel. I know you're going to do it because you already did it. You already liked, you already subscribed, and you already comment. All right. See you in the next video, part 2.